Here in the metro is projected to get worse. You could be impacted at the hospital or doctor's office.
First Alert 6's Bella Caracta shows us a model that's helping and how others can follow suit.
You know, when you go into the hospital or a doctor's office and they ask, is it okay if a student watches? Those are critical clinical hours for their learning. It's also the biggest limiting factor, some say, when it comes to training future health professionals. Nurses.
They're with the patients, 12 hours. They're there every single day, 7 days a week.
Behind the scenes of the biggest hospital system in the state.
We're seeing the imbalance of the amount of patients needing care and less total nurses available to take care of patients.
According to the Nebraska Center for Nursing, here in the metro, we're projected to go into next year short by more than 2,600 nurses. That could mean less hands-on care when you need it. Kelly Vaughn is the chief nursing officer of Nebraska Medicine.
We feel that intensity of the nursing shortage here in the Omaha metro area as well.
At the last Nebraska Board of Regents meeting, a regent asked President Dr. Jeffrey Gold what's holding them back from raising more doctors and nurses in the state.
The single largest restriction, certainly that we face, but is present across the United States, are actually clinical binding sites. Anything that we could do to increase hospital participation.
He's talking about the partnership between schools and hospitals. That's something Clarkson College and Nebraska Medicine say they successfully created.
My clinical coordinator and their clinical liaison at the hospital work closely to get all of our students placed.
Nebraska Medicine says they accommodate 100% of their clinical hour requests.
I'm a nurse myself. We all as nurses were trained by the best and the brightest, so just recognizing that opportunity to continue to provide that training that we all receive.
But the latest report by the Nebraska Hospital Association shows 1 out of every 5 Nebraska nursing schools aren't so fortunate.
You can't imitate in a simulation lab or on a mannequin.
They both offered a few solutions.
It's so multifaceted.
1, establish school-hospital relationships. 2, nursing students should be open to evening or overnight clinical hours. And 3, train and hire more clinical instructors. They also tell me there needs to be stronger pipelines to encourage younger students to apply for nursing schools. I'm Bella Caracta, First Alert 6.